Hello, everyone. I am Karla Black. I'm one of the Deputy Administrative Health Officers here at the Health Department. I am going to tell you a little bit about who I am and like how I got into public health, because a lot of people actually in public health like did not go through kind of like the traditional format that all of you are kind of going through right now, having an MPH and then moving into public health. So I'm going to tell you a little bit about myself, and then I'm going to tell you about our administration division a bit. And then I'm going to go into all the crazy things known as public health emergency preparedness, because that's what I did for the last almost 12 years of my career before just transitioning into my new role this year. So I am actually a transplant. I am not from Michigan. I am one of those Illinois people. It's Illinois, it rhymes with Illinois, I know. But also because I'm from there, I get to make fun of it, so I will.
But you can't.
But you can't. Well, maybe you can't, but so I grew up in Illinois. I went to the University of Illinois, and I'm going to date myself really horribly here because it's all a part of the story of how I got into public health. My senior year, I was studying chemistry and biology because I'm kind of a terrible person and I like diseases, blowing things up.
She wasn't very good at chemistry.
Yeah. Fortunately for everyone, I wasn't very great at it. So anyway, I was doing chem and bio at the time, and then 9/11 happened my senior year of college. So you can backtrack and figure out how old I am now. And hopefully you think I look younger than that. But so I was trying to figure out what am I going to do, because there were no jobs. Everything just kind of locked down. No one wanted to hire anyone because there was just so much uncertainty at the time. And I actually had a professor that was the head of the American Society for Microbiology at the time. And guess what she studied? Anthrax. Great. And so one of the coolest things that she had us do was she's like, for extra credit, because I'm one of those people, write me a paper on what you would tell the public about anthrax right now. Should they be scared? What should they do? And I was like, I really got into that. I was like, that's really cool. What would I tell the public about anthrax? Should they be scared about this? And, just kind of working me through what would the public think? So that kind of stuck with me. But again, at this point, there are no jobs. No one's hiring anything. Not going to happen. So I was like, well, I guess we'll go to grad school. This seems like a good idea, right? And so just because of my background and because of the kind of where the world was, I was like, bioterrorism agents sound cool. Let's do that. And so I actually decided to go to Purdue, and I worked on my PhD, and I worked on viruses. So I worked on flaviviruses, which include yellow fever, dengue, West Nile, those types of things. And so I was working on like the molecular level. So I wasn't on the mosquito level or anything like that. We're talking like, I know I'm probably the only person in the entire world who knows one helix in one protein of yellow fever. I know the sequence, it's burned in my brain. I should probably have a tattoo of it, but I don't.
What is it, Karla?
DKSALSEFIKFAE.
Let's see if you're lying.
Not lying. It's still burned in my brain, and it's almost been 15 years. It's still there. But so I was doing that, and it was really cool. But I got to the point kind of where I was like, you know what? Is this really helping anyone? I mean, everyone just heard me like rattle that off, and everyone's like, okay, nerd, good job. But does that help anyone? Not really. I mean, it was cool research and everything like that. It just wasn't my style. And I started to kind of think like, well, what's next? Like, what am I going to do? Because I don't know if I want to do Westerns for the rest of my life that don't work. And so walking down the hall one day at Purdue, I see a sign, and there's this, and it's like Homeland Security classes. I'm like, that might be interesting. And so I went and took the classes, and we actually had one of our professors was a public health person, and she was the head of APHA. And she's like,
American Public
Health Association. Yeah. And so I know some of your students will be going to the conference soon, and Janie and I will both be there. So come hang out. She's like, I really think like you would be great in this public health realm. And I was kind of like, okay, let's hear more about it. Because I thought, STIs, immunizations, I didn't really know much about public health, but she kind of walked me through it, and I was like, okay, this seems really interesting. And then the Department of Homeland Security actually put out a grant for researchers to see if they aligned with, anything Homeland Security related, and considering I was working on viruses, I ended up getting the grant, and to pay it back, I had to work in something Homeland Security related for a year. And actually they were like, because I was working in public health and on viruses, when I graduated from grad school, guess what hit then? H1N1. I'm not allowed to go to school ever again. No more. And so I actually got picked up by the state of Illinois to work on their H1N1 after action report. And so that's kind of how I got into public health, like truly into public health. And this is where I get to make fun of Illinois. They're a hot mess. Don't ever live in Springfield. I can tell you stories. But really, their funding and everything, and one day they're just like, we don't have any funding for you. You need to go home. I'm like, oh. So I ended up like working at Target and a Halloween store for a while. And I was looking for jobs, and I came back and I found a job in Michigan because I met somebody. They're like, hey, we have a bioterrorism coordinator position open. You should apply. So I ended up like getting a position in Allegan County, and I was there for a year, and then I came up here to Kent. I've been here since 2012. So it's been over a decade now, but it's been awesome. And I actually just changed from emergency preparedness coordinator to deputy health officer in February, but I will tell you all about the things that we've had to do in the past 10 years of just weird stuff, but it's all about evolution in public health. I started here as the emergency preparedness coordinator, and then in 2017, I got additional duties as assigned. That will be part of your career. Don't think it won't be. But I got workforce development and quality improvement, but it's always about growth. Like, what else can you do to make yourself more marketable, learn new skills, get out in the community, you know, always be open to those experiences to find out like how you're going to get there. Because I honestly, I don't know if I would have ended up in my new role if I didn't have those additional duties as assigned. I mean, fortunately or unfortunately, like the people in preparedness are very specialized, and sometimes we don't always get, I guess, the credit of like being true public health people. But you want somebody in your corner on bad days, you want your emergency preparedness coordinator to be really good and know all the crazy things that are stuck in the back of your brain. I can tell you all about how to bury people that have been exposed to radiation. These are the things you learn. Fun times. So that's kind of been my background, but I just want people to know, network, be willing to change, and learn new things. Always just be willing to jump in and learn that new weird thing, because you never know what's going to take you. So that's me. Just quick quiz, because fun things happen here in Kent County. Which of these things occurred in Kent? Grand Rapids became the first city in the United States to add fluoride to its water in order to decrease tooth decay among its residents. The first polio vaccine was invented by a young physician named Douglas Doogie Howser. C, two female scientists, Earl Kendrick and Grace Eldering, created a whooping cough vaccine. So D, both A and C, or E, none of the above. Janie.
Nobody else wants to guess? I think that I know the answer is D.
It is D. Actually, we were the first city to have fluoride in its water. And then also, this is where whooping cough vaccine was created. So we have a long-standing history of excellence in public health in Kent County, and we'd like to continue that. So I'm going to tell you a little bit about who we serve. We grew rapidly over the course of the last 10 years. So when I first got here, we were using the 2000 census, and I could always rattle off that we have 622 people in Kent County. The new census, though, we bumped up to 657,974 people. We gained more people in our county than some people have in their entire county. That's big for public health, because now we have more people that come from different places, backgrounds, everything. So we have to take into consideration, how does that impact public health in our county? And so we're one of the fastest growing in Michigan, along with Ottawa County, which is right next door. 21 townships, 5 villages, 9 cities. Here's our racial makeup. I'm not going to go through it line by line, but we're diverse, but not that diverse. I mean, we're West Michigan, but considering compared to other counties in West Michigan, we're more diverse than others. So again, knowing your county, knowing your jurisdiction, how do you serve the population? What do you do with what people are looking for? So I'll tell you a little bit about administration and more the programmatic side of things. So administration serves basically the entire department with finance, resources, things like that. I'm not going to go into that, but I'm going to go kind of more into the programs that administration has. So what, of course, my favorite, I'm not lying because everyone knows, is emergency preparedness, just because I was there for many, many years. But I think I am loud. If not, well, I mean, I have lots of favorite children in the department, but still, this one's the one nearest and dearest to my heart. So planning and training for anything that goes bad with public health, and honestly, a tornado, a wildfire, anything, that's public health. I mean, some people don't really think of, public health preparedness outside of COVID-19 or anthrax or anything like that. But winter storms, that's absolutely our problem. We might not be the lead on it, but it's definitely our problem. I mean, so back in 2019, when we had the polar vortex, we were over in the Emergency Operations Center working with all the different response agencies, trying to make sure people had the resources that they need to survive the polar vortex. Because in emergency preparedness, really your big job is to know people, know things and know people. And if you don't know the thing, you need to know the person to go find out the thing. So, in preparedness, you have to be able to get out of your shell and talk to pretty much anyone. And so that might be hospital CEOs, that might be the preparedness staff, that might be somebody in fire, law enforcement. You have to figure out how you talk to them, because everyone has their own culture. And sometimes you might have to be a little bit stronger to some response agencies. You could probably guess who they are versus others, where you work with like nonprofits and making sure like, hey, can we work with law enforcement to have them go out and check on people that receive Meals on Wheels meals, because we want to make sure that they have food and that they're okay during the power outage. So we were able to pull a list from Meals on Wheels, work with law enforcement to get them to go out, all those cool things. So it's all about relationships. So we train the community and our own workforce to be prepared. That's a lot of what we do. And here's a nice list of recent responses. So Ebola, floods, tornadoes, PFAS, or vortex. Oh yeah, and COVID, that minor detail. So we'll talk a little bit more about that towards the end, because I have no problem telling all the crazy stories.
I have a quick question.
Yeah.
With that, do you typically, depending on the response, do you generally work with the same kinds of people and organizations, or is it really depend on the situation? It's
super dependent on the situation. So we do everything from, COVID, which that involved everyone. But when you get on kind of that smaller scale of things, it almost gets kind of divided into like three major buckets. It gets divided between like infectious disease. So is it like outbreak due to a restaurant? And so in that case, we might be working with MDHHS or other counties and the restaurants. But then also you have kind of the natural disaster type thing. So like floods, tornadoes, winter storms. That's when you're working more with emergency management and fire, law enforcement, some more your traditional type things. But then also within the health department, you have environmental health concerns. And so anyone here heard of PFAS? See a number of heads. So we had a big situation. I'll go further into depth if we have time about it, but that's when you start working with like EPA and a lot of federal agencies, because that was really bad. We had at the time, and I don't know if it's been beat yet. I hope so, but yet not, because I don't want to have the county that has like the highest count of PFAS in the residential well in the nation. Not great. So we had to work with a lot of different EPA and it was DEQ at the time, now Eagle, but a lot of different partners for that. So it's very situational dependent on who you have to work with, but those kind of are the main buckets, things that we work with. So within administration, we have our communicable disease unit. So I currently, now they're under me. I'm super happy to have them. They're the fun bunch, honestly.
I met Kathy at the panel.
Yeah, you met Kathy.
So Kathy, yeah.
Did she talk about poop?
She did talk about liking to talk about it. She didn't get a chance to really dive in.
Yeah. I mean, they are so fun. I mean, you want to talk about poop, you go to CD. But they're really kind of our eyes and ears in the community in terms of communicable disease. We have, iwaspoisoned.com is out there. So, you know, we have people who report in like, hey, I ate at a restaurant and now I'm sick. And so we're monitoring those. We also have access to the Michigan Disease Surveillance System, MDSS, that she probably talked about. And so they're always kind of churning that data, trying to see, you know, are there any things that are popping up that we need to be aware of? And because they're the canary in the coal mine for us, we need to make sure that if we see something start to spike, we need to, you know, hit the ground running and try to put a stop to it before it gets worse. We actually just had a outbreak. We're part of a nationwide outbreak that was kind of first detected here in Kent and Ottawa County. Did anyone hear about the Chickasaw E. coli issue?
Wendy's.
Wendy's.
Yeah. Mhm.
I can say Wendy's now because CDC put that
Oh,
out.
I wasn't supposed to.
Oh,
I was
no.
playing charades with her, 'cause she was like, there's an outbreak at some restaurants, and I was like, cool, so I was going to lunch, where might I avoid? She was like,
Like, I'll blink twice.
Yeah,
You did the right one.
but you had a McDonald's cup, so I was like,
Yeah. No, it's fine. And they're still working on looking at what the actual cause was, but you know, the suspect food is probably romaine lettuce, but and it was happening. I mean, on burgers at Wendy's, salads were fine because they're two totally different distributors, but that's kind of where they're thinking it's coming from. But again, they have to go through all of the testing and all that to figure out that's actually where it came from. But they also do foodborne illness through that. They do animal bites and exposures. I know Kathy talked a lot about it, so I'm not gonna go too far into this just to save a little bit of time, but the CD unit's awesome. One of the things that people don't necessarily know is that we also quasi have the medical examiner in our administration. It's nebulous because it's more of a contract, but they're a part of the health department, but not necessarily because they actually live over in Spectrum. And we contract with them to do all of our investigations on deaths. And so, as part of my previous role, I would work with the medical examiner for the mass fatality plan because that can happen. And, but also, every month they run a case review where they go through all the deaths over the course of the month that, meet the definition to be investigated. And it's a really interesting thing to see because you see the autopsy photos, but they're talking about how did they die? And as a public health person, what do you think, like, what would you be looking for if you attended that?
if there's like a recurring pattern from certain topics.
Exactly. So you're kind of looking at the overall picture. What are killing the people in Kent County? Because before COVID, typically, because you kind of have to have a interesting sense of humor, as Dr. Cole does. If you ever get a chance to meet him, he's a really funny guy, but you know, we kind of keep track. We're like, okay, how many opioid deaths are there? And we were tracking, like, is it fentanyl? Typically it's fentanyl or heroin were the two that always kind of rose to the top. But also suicides are also a big one. And like, how was that done? So you're kind of looking at those trends. So that's all part of public health. And you kind of bring that back and like, how does this relate to what we do here?
And accidental deaths.
You see some of those?
Pedestrians, things like that.
Yeah. Mhm. Yeah, so you're always, because it's all public health in the end. So, it's a really good partnership to have with them. Quality performance and accreditation. So this one's like partially in administration, but also in the Center for Community Health Strategy where Janie is, and we work a lot on this because we're both state and nationally accredited. And so kind of admin has more of the realm of state accred, whereas CCHS has more of the realm of national accreditation. So, but there's a lot of like overlap between them. And so quality, performance, accreditation, there's different pieces in different parts. So typically I have the workforce development and quality improvement still pieces of it, but Janie has the overall like oversight of accreditation for nationally, but our grants manager has more of the state piece. And so, but all the things still kind of cross over. So we have to work together a lot on trying to figure out how we're going to meet all those standards, because unfortunately sometimes the standards don't align. So some things that the state asks for, national accreditation doesn't ask for. And so you have to make sure that all your plans meet both, because you really don't want to have two plans for two different accreditations. So we do a lot through that. Our marketing communications has kind of changed a bit. We had our own public information officer, Steve Kelsley. You probably seen him on TV. He used to be with Fox 17. But now he's ours, but now he isn't ours anymore. Now he actually got poached and got taken downtown. Because what happens to us is like we have really great things here at Kent County Health Department, and then downtown steals them from us all the time.
What do you mean by downtown?
County itself.
County
So we're
itself.
under the county umbrella.
Yes.
Oh,
And so they like to steal our people, especially in communications. But Steve really did a lot of really great things during COVID. If you watch the videos on Facebook that our health director did, Adam London, that was Steve working with them. I don't know if you pointed out, but we have a studio right down the hallway. Like I don't know of any other health department necessarily that actually has a legitimate studio. So we can record trainings there, we can record any sort of thing that we need to do. And so we're super fortunate that we have that, but now we have to share. I don't like sharing. So, but press releases, our social media accounts, all that comes out of that now. So in terms of time, we have a half an hour for all the EP stuff. Before I jump there, any questions about administration? There's finance too, which is a really big part of that, but I'm not super well versed on finance, other than don't spend too much money. Make sure you get a PO. Don't just randomly order stuff. They get really mad at you if you do that. Okay.
I have one quick story. I was
Yes.
talking about the medical records being housed here. I was working on FAB, that national accreditation one night. I was here alone. It was like 8 PM and it was raining, of course. So like kind of spooky anyway. These are all motion activated lights. So the lights went off. I like jumped up and like waved to turn them on, but I'm like facing this parking lot. Someone pulled in right there and I'm like, oh, okay. In a van at 8 PM. And then I saw this man run through the rain and he's like trying to talk to me through the door. And I'm like, oh, hold on. Answering that, he was like, I need you to sign for this. And I was like, sign for what, sir? Again, through the door. And he's like, the body. And I was like, no, I will not do that. And I was like, what are you talking about? So I don't know if he just like did a random Google and saw like morgue. And so he brought it here. And I was like, no, we have paper records, not human bodies. So please take that and go. But that's happened. Our colleague Dawn had someone try to give her a brain and a cooler or a
Yeah,
parts cooler.
we've had a lot of weird stuff.
Yeah.
And then also my phone number is really, really close to the medical exchange where people call in. So I get I shouldn't say lots of calls, way more calls than anyone should about, people grieving and like, well, what happened to my aunt, or, where is my son's body? And I'm like, sorry, I'm gonna have to transfer you. And that never feels good.
No.
I mean, like, cause you wanna help them, but, and you never really want to say, I have to transfer you. You got the wrong number. I'm 7242, you're looking to 7247.
That's what Kathy mentioned that too. So Kathy and communicable disease, as much as she's like, they are a fun bunch, but they also do have situations with fatalities and like they oftentimes like time is of the essence. So she'll have to make calls. And I don't know if you can think of specific examples, like we don't have any rabies cases. So like that would be one where she would need to call like pretty quickly to figure out what's going on. But there's other things where like they have to be very, very, very empathetic because they're talking to folks that have just experienced a tragedy. But we also need to get information as quickly as possible. So it's really a very nuanced and skilled thing to be able to get information while prospecting.
Yeah. I mean, botulism would be one that would be pretty scary.
That's usually younger.
Yeah. Meningitis could be another one, especially like on college campuses. So yeah, there's a lot of things that they have to do and be very mindful of our community. So, any other questions about admin or anything like that? Okay, feel free though to jump in. It's okay. I as you can tell, pretty laid back. It's okay. So now we'll jump into the emergency preparedness side of things. So what I used to do, but now we have other people that help out with us. So we didn't lose depth, we actually gained depth because we were able to hire another person on. So we didn't lose like institutional knowledge, which is always a good thing in public health, because when somebody leaves, we lose all of their knowledge typically. So fortunately now we kind of have 3 people knowledgeable in preparedness, but we'll get there in a minute, but it's exciting. So what I used to do, really, the big buckets of preparedness are planning, training, exercising and responding, and then evaluating it. So we do this on a continuous basis all the time. So plans really are, what are we gonna do and how are we gonna do it? And I always like to look at them as guidelines. They're not hard and fast by any means. If you learn nothing at all, other than this, you will fly by the seat of your pants because no matter how well you plan, it will not go that way. Nope, it will not. And so you have to be like Gumby. You're always trying to figure out like, okay, my plan says this, but now the situation dictates that's not going to work. So how are we going to jump to the next thing and make this work for our current situation? Because, I mean, we had plans upon plans, like we have around 22 different plans for our emergency operations plan. So like all these subsections. So like that includes mass vaccination, that includes mass prophylaxis, volunteer management, environmental health, communicable disease. I mean, it runs the gambit. We used them during COVID. But did we really follow them? No, I mean, we used the basis of them, but we had to pivot a lot on what we were gonna have to do. So, and I can tell you more about that, how we got there, but, training, who does what? And because you can't write a plan and not tell anyone about it. People get really mad about that. Like, oh, you wrote a plan and I'm supposed to do what now? So what we would always do is we would train people at our all staff meetings, because the thing about preparedness is that it's not always in people's forefront of their minds, because, you know, you might be community health worker or a nurse in clinics. Are you thinking about like the incident command system and what role you're going to play during a disaster? No, you're worried about getting shots in arms. You're worried about working with your clients, but we always give them like a 10-minute snippet during our all staff meetings. And also I'm not above bribing people. I throw candy at them to listen to me.
That's stuffies. Stuffed animal.
Yeah, I have stuffed animals. Has anyone heard giant microbes? Not a you know, commercial or anything like that. I have a strange obsession with them, and I have a lot of them. I get them for like holidays. I have ornaments, but like if you don't know what they are, but they're basically stuffed animals of like anthrax and Ebola and COVID, syphilis. And so we actually, right now, September's preparedness month. We're not doing it right now, but prior to COVID, we would do preparedness month for all of our staff to get them ready. Like have a personal plan, have exercise your plan. And then if you did a couple other things, we did an escape room in 2019. It was so much fun. But we also bring speakers from the National Weather Service, the FBI, and other things like that. If you did a certain number of things, you got a giant microbe, or you get the special pin, shows that you're aware, or if you do all the things, you get the certificate of awesome. And I named it that. Because I can, but it makes things fun for people to get involved in these things, because it's not part of their daily job, and it makes it interesting for them. And so, and also people like to achieve things. And so how do you get people involved? Carrots, pins, pens, stuffed animals, candy, what do you gotta do to get them involved? So, but that's all part of training, because it helps people get more prepared, whether, you know, if your staff are more prepared by having a home preparedness plan, because now they're ready to be able to work because they know that their family's taken care of. Great. That helps not only their family, but that helps your community. So it's all about training. And then we get to either exercising or responding. Exercises are when you have a simulated event. So we can do a whole number of different things of what that looks like. So either I could have a PowerPoint up here, we could talk through a whole scenario. That in itself is an exercise, because you'll talk through like, well, our plan says this, but would that actually happen? Well, no, because we don't have that resource, or we don't have that capability. So that's a really cheap and easy way to get through learning how your plans will or will not work. The fun ones are the full scales, and that's when we actually get out like the ambulances and all the partners and the bells and whistles. I'll tell kind of a funny story, horrible story. So back during the days of Ebola, when it felt like the zombie apocalypse was upon us, and, you know, people had Ebola everywhere, even though they didn't, but, you know, the media made it feel like that. We didn't exercise out at our annex. So we worked with our EMS folks and they got dressed out and we were going to transport Ebola patients out of there. And then we were going to take them to one of our local hospitals where they have a special unit for them. And our staff knew all about it, so everyone's like looking out the window and all people dressed out in full-blown PPE. We transport them to the hospital and I'm saying, hey, this is going really well. Never say that during an exercise because that's when it's gonna go sideways. And so we're about to put out a sign with our regional partner saying exercise in progress because, you know, we have people dressed out in full PPE at a hospital. Some people are gonna get a little concerned, right? The person from the hospital may have said, don't put that out. Our staff don't know that this is coming. This is a no notice drill for them. Oh crap. So we're now taking EMS folks who are pretending to have Ebola into a hospital. Does anyone work for EMS here? Okay, now EMS people are fun and festive and they will go ahead and say, of course I have Ebola. I got bit by a monkey last week in Africa. And they almost got an IV put in because they just kept going. And I got a call like, hey, when they go do this, can you like stop the exercise? And so I'm like running down the hall trying to find what room they're in. And like I see a doctor starting to get dressed out and I'm like, wait, this is just an exercise. And he dropped everything. It was just like, oh, thank God I didn't want to do this today. But like the EMS guy, he was just like, oh yeah, I didn't have a temperature because I popped a Tylenol. I don't have a temperature. Yeah, I got bit by a monkey in Africa last week. I mean, he just played it up and they were ready to stick him with anything else. So yeah, it was fun. These are the fun things that we do when we exercise. Don't do that ever to anyone, please don't. But then we get to the evaluation piece of like, what can we do better? Because that's always a big thing, because no matter what, you're gonna learn something new. You're gonna have a new partner, you're gonna have a new policy, something went sideways, I promise you, and usually it's communication. So a lot of people think, you know, before bioterrorism was the really big one that this all started from, so anthrax, all of that. But now pandemics, everyone thinks that we do pandemics, which is accurate. And epidemics, but we also have outbreaks, you know, and that involves like our foodborne, things like that, and environmental health issues. Those are typically where we live, because these are the things that are more likely to happen, right? Everyone's now familiar with this. I mean, before I used to show the slide, they're like, oh, pandemic, that's not gonna happen. That happened a long time ago. We're not worried about that. Well, yeah, we are. And so we have to plan for all of these things. But always our priorities are life safety, incident stabilization, protection of property and the environment. So everything we do starts off with how do we protect life? And so that can involve any number of things. And because that's not only looking at like the community, but that's also our responders within the health department and our response community. And so we're always trying to think through like, what does that mean and how do we ensure the safety of everyone? And so that takes a lot. That could be through personal protective equipment, so masks. Sometimes we have to put orders in place. That happens. It's not like a power we like to wield very often. I mean, obviously you all are in the MPH program. I would say the vast majority of people don't get into public health because they like to wield power. Typically, no. We're kind of like the kind, gentle people that like really want to help everyone, but we do have public health powers in the state of Michigan. So our health officer had to sign a mask order because we felt that that's what we needed to do to protect the public's health. Politically, was not the greatest thing. I'm sure people saw what happened down at DeVos Place back in August of last year. We had I think 6 hours of public comment saying otherwise, that people didn't like it, but we had to do what's right. And so that's always what we're aiming for. That's the first thing. And then incident stabilization is trying to make sure that what's currently happened doesn't get worse. And then property and environment, you know, trying to make sure like our water aquifers are still intact and able to use water. So in preparedness in Michigan, we have locally emergency managers, so that's typically out of the sheriff's department, so they're the ones that are in charge of fire, EMS, like all those types of bad things, whereas on the public health side, you have us. Regionally, we have healthcare coalitions, and they're typically over like the health systems and their preparedness. And then the state, we have Michigan State Police, the Healthy Food Services, Eagle, and also MDARD. So we have a lot of partners that we work with when it comes to preparedness. And our local health departments, there are 45 local health departments. Here at Kent County, we're very fortunate because I provide oversight to the program, but we have an emergency preparedness coordinator, Pat Draper, who's up there on the top. So she's our one full-time emergency preparedness coordinator now, and then we also have an emergency preparedness specialist, and that's Mindy Hunsinger, and she was actually an MPH student right here.
She did her internship.
She was my intern, and so I was super excited because I never get to hire anyone ever. And so I actually got to hire both of them. I was so excited, but Mindy was my intern during the beginning of COVID. And it was kind of fun because during her interview, it was the first time I'd ever met her in person. But I talked to her a lot on Zoom, but finally I got to meet her in person. So it was great. She's doing a phenomenal job. So we do a lot of great work in there, but Kent County is one of the few that actually has more than one person in preparedness. And even then, that's not enough for over 500,000 people, but small but mighty. And so a lot of what we do outside of the department is really that public information piece, because we need to be quick, nimble, and getting information out to the community. And we have a public information officer for that. But it has to be a coordinated effort because as you saw during COVID, you had CDC saying one thing, you had the state saying another thing, you had local health department saying another thing. I have never been so mad in my entire life, to be very honest. At the very, very beginning of COVID, the first night we got our first cases, we were actually sitting right in here, and we were getting ready to do a media event because we knew we had our first 2 cases. We're sitting on it because we heard that the governor was going to come on TV, and we're waiting, and because we were not going to shut down schools, like that was not our goal, and we were getting ready to say that, and I think we ended up, it was already out that we weren't going to do it, and then chopped us out under the knees and said, oh, guess what? We are closing schools. Would have been nice to know that. So that was one of the really big challenges of COVID and any disaster, honestly, is communications and making sure all the right people know what they're supposed to know. Because a lot of times when people were finding out different things through the media, like, oh, guess what? Now people over the age of 65 are eligible to get vaccinated. We found out at the same time as everyone else. And so then we started getting the phone calls like, well, when are you gonna start vaccinating? We're gonna start vaccinating. What? We just found this out 5 minutes ago too. We need a minute, but everyone's just like, but why don't you know?
And any breakdown in communication, people tend to think is your fault. So if
Yes.
CDC has said something,
Mhm.
even if it's changed, like Karla said overnight,
Yeah.
we don't, with the time, I don't know, actually, you know how many contact tracers we had?
I think we were up to 200 at one.
Yeah,
one
we had
point.
a ton of contact tracers, so it's like you have to get them oriented with whatever the new guidance is. It's really tricky, and so if you've got someone calling the next day saying, hey, is your 10 days up, or doing all of this follow-up, but something is shifted, it just there's that little, even if it's only a day lag, it's
Yeah.
enough that people are like, well, you don't know what you're talking about. And
Right.
It's like, oh, we do.
Yeah,
We're not
certainly-
making the rules here.
it certainly fed into the mistrust. And I think one of the things that I wish I would have seen early on in terms of public information and everything like that was, I wish CDC would have said, the science will change, the guidance will change. It might change rapidly. That does not mean we don't know anything. It just means we're learning more. Because if people had that expectation that things were going to change, we probably wouldn't be in the situation we're currently in. Instead, we got, well, CDC doesn't know anything. I mean, and then that all trickles down to the state, that trickles down to the local health departments. And, we had a lab, but it's not like we were, we're not doing basic research on COVID. So how are we gonna know? We don't have that capacity to do that. Like, we rely on CDC to come up with that. And so the messaging had to be better. And, also you get the talking heads to oh, there's gonna be testing sites everywhere within like a day. No, there's not. And then everyone calls you like, where's our testing site?
And then you also have to keep in mind that all of this guidance is coming down in English.
Mhm.
We have many languages we need to
Yep.
get information out in. So there was also, we noticed very early on that in addition to the normal lag that we expected, trying to switch things really quickly, there was an additional lag for folks that were oftentimes experiencing the worst health disparities like from the beginning. And so we very quickly, there's many things we did, but we brought on community connectors and navigators, who are members of those communities. And basically, we broke down some bureaucratic red tape around communications, whereas in the past, it'd have to go through all of these checks, he would have to have his eyes on it. We were able to kind of fast track that, so people could say, okay, I'm gonna get this out to my community through WhatsApp, Facebook, just non-traditional routes, which really made a big difference. I'm not sure how all health departments did it, but, you know, that was something we recognized a need for very quick.
Yeah, and we were one of the few that had ASL interpretation for our videos. So that was, I think there's always room for improvement. I'll say that. I mean, because especially for like translation times of documents, we still struggle with that.
And it's hugely expensive. I mean, that's the thing
Yes.
too, and you hate to like use it as an excuse, but it is a valid one that anything like that, especially to do it quickly, costs an immense amount of money. Having an ASL interpreter for every single video costs a lot of money. Eventually money started coming in related to COVID response, but for the, I don't know.
Initially,
first
we didn't.
couple months, there was nothing and our workload was through the roof. I mean, you slept at the health department,
Yep.
like, it was wild. It was really tough on our staff.
Yeah, like there were times like 4 hours of sleep, like go home,
It
shower.
does not get paid for overtime,
Nope.
so a true hero.
What you do? But and JD too. I mean, she did a lot of great work with our contact tracing and everything like that. I mean,